small fractures in your vertebrae, which are very painful. And the reason that women are yes, what happens is women that have osteoporosis tend to shrink because their vertebrae, there's fractures and they shrink down in size, and it's a painful situation. Yeah, yes, there is. As a matter of fact, it's calcium. It's just over the counter. You can buy calcium with vitamin D. Situation. Yeah, yes, there is. As a matter of fact, it's calcium. It's just over the counter. You can buy calcium with vitamin D. It's calcium. It's just over the counter. You can buy calcium with vitamin D.
Is that because I didn't drink a lot of milk, and that's
It's
why
either
my
not
bones are
drinking enough
weakened?
milk or getting calcium from other sources in your diet. You don't necessarily have to get calcium from milk, but most people don't. Don't get enough calcium in their diet. And so, especially women, and as I said, the reason that women are prone to osteoporosis is because your bones are less dense to begin with than males. And so, don't get enough calcium in their diet. And so, especially women, and as I said, the reason that women are prone to osteoporosis is because your bones are less dense to begin with than males. And so, men do get it, but at a much lower rate than women. And so, what you should do is take, if you're not drinking 3 or 4 full glasses of milk every day, which I know I don't, then you should supplement your diet with calcium tablets with vitamin D, because the calcium with vitamin D is more effective than just the calcium alone. Because the calcium with vitamin D is more effective than just the calcium alone.
So I guess it just depends on whether or not you like milk. I mean, you could take the medicine that does have the vitamin D. And like you said, most women aren't getting enough anyways.
That
So.
will help. Sometimes it's not enough, the calcium alone. If someone has active osteoporosis, and your doctor can actually run a test and do a scan on your foot. You just put your foot in a little, like an x-ray machine. It's called a DEXA scan, and they can tell if you have osteoporosis or something called osteopenia, which is kind of the step before osteoporosis. If you actually do have osteoporosis, then you should be on additional medication. If you don't have osteoporosis, it's still a good idea to take the calcium with vitamin D because that'll help prevent it down the line. So what I usually recommend to all my patients who are women that are not drinking a lot of dairy or getting a lot of calcium in their diet, even when they're young, is to take calcium with vitamin D every day. Because even if you do not have osteoporosis, you are at risk of it simply because you're a woman. And taking the calcium will help prevent that.
So if I go get the medicine, I mean, say it's a new medicine. And I read the label and I said, okay, this medicine's for that, this one's for that.
Oh, for calcium? For the calcium?
If the name on the label is something that's so tiny,
simply because you're a woman. And taking the calcium will help prevent that.
okay, so if I go to the doctor and I make sure that it's a new medicine. So for example, look, here's the label. Doctor gave me this and he said, oh, this medicine's for this one's for that. So if I get a new medicine,
for calcium? For the calcium?
and I read the label, the medicine on the label, that name is right there. If you see right there on the side, this is for blah, blah, blah. That's when I understand. So, I mean, the lettering is so tiny on the bottle. As long as I see this one word out, I'll understand what I need.
Calcium does not require a prescription. I can just sell you a bottle of calcium, but I could actually write on the bottle that it is for strong bones or whatever would help you remember why you were taking it. Now, do you drink milk at all? Or eat a lot of cheese?
Oh yes, sir, I drink lots of milk.
3 or 4 glasses of milk a day?
Yeah, I drink it in the morning and at night. Well, actually 2 at night, so a total of 4 or 5.
Then you may not need to take extra calcium. You may be just fine.
Well, I also have to drink a lot of water, and that's more than milk. So, do you know why? It's important to drink.
You may not need to take extra calcium. You may be just fine.
Well, maybe I should be drinking less. I mean, I drink a lot of water, a lot of water. It's more than milk, really. it's important to drink water more than milk, right? But it just seems like if I drink more water, it's important to drink water more than milk, right? So if I drink more water, it should make my body better, right? Is that the right thinking?
I think that you should drink enough water so that you're not thirsty. I don't think you have to go overboard with drinking a lot of water. But I think if you're concerned about osteoporosis, you should, when you see your doctor the next time, ask your doctor, and they could do a screening on you and tell you if you actually do have it or you don't have it. Sure. They could do a screening on you and tell you if you actually do have it or you don't have it. Sure.
Well, I have a specific problem here in my throat. With whenever I swallow something, I can't. For example, meat. I can't eat meat. I had to take that out of my diet. So I might have surgery in my throat in order to get rid of the cancer, and so my voice. It's really hard for me to speak. I mean, I can sign with the kids, but I mean, I'm more serious towards myself. So I need to make...
Absolutely. It's a quick and easy thing that they can do to determine it, and probably a good idea at your age to check. Probably a good idea at your age to check.
I'm old, you know, I'm 77. So as you see, I am old.
Not so old.
What?
Not so old in these days.
I don't really feel old, no. My heart's strong and I still work. And I keep myself busy. I don't just sit around and become lazy. That's one way for you to become old quickly. I just try and keep myself active and feel good.
Absolutely. That's why it's important that you keep your bones nice and strong, right?
But what about my legs? If I keep my bones strong, what can I expect for my hips?
Why do the hips? It is the place that people will have fractures, and it's because there's so much weight bearing on those hips, on that hip joint, that it will break. Sometimes people fall and break the hip. Sometimes the hip breaks before they fall. It's hard to determine sometimes, but because there's that weight bearing on that hip joint, it tends to fracture there, or they fall and that's where they fall. You're welcome.
Well, thank you very much.